Today we begin with an investigation regarding the COVID-19 vaccine shortages. There are serious questions about an incorrect claim made by top scientists at CDC, the nation's premier public health institute. Critics call it misinformation. CDC chalks it up to an honest mistake. Whatever it is, it resulted in vaccines going to some who are said to need it the least, depriving others who are said to need it the most. Like a lot of Americans, Congressman Thomas Massie already had coronavirus and wanted to know if he should still get a COVID vaccine. Most everyone who's had COVID-19 is considered immune, but how long immunity lasts is unknown, whether it's after infection or vaccination. An award-winning scientist himself, Massie quickly found that vaccine studies showed no benefit to people who've had coronavirus. Vaccination didn't change their odds of getting reinfected. The controversy began when Massie noticed the CDC was claiming the exact opposite. CDC's Advisory Committee on Immunization Practices had just issued a high-profile report authored by 15 scientists. It wrongly claimed Pfizer's study proved the vaccine is highly effective or showed consistent high efficacy for people who'd already had coronavirus, SARS-CoV-2.
It says the exact opposite of what the data says. They're giving people the impression that this vaccine will save your life, even or save you from suffering, even if you've already had the virus and recovered, which has not been demonstrated in either the Pfizer or the Moderna trial.
The mystery deepened when Massie contacted CDC for an explanation. Massie says he was so alarmed by the misinformation, he decided to record the calls. On a December 16th call, CDC's Captain Amanda Cohn seemed to agree that people who've had coronavirus shouldn't rush to get vaccinated.
People who've had disease, given that there's limited doses right now, we are suggesting that those people wait.
Right.
That suggestion to wait hasn't always gotten out.
Should I get the vaccine if I've already had COVID?
Most experts say it's a good idea because they're not sure how protected you are after recovering.
Our full measure investigation examined the database reporting illnesses after COVID vaccines. It shows numerous people are getting vaccinated even though they've already had the virus. Some experts say that's depriving others who need the vaccine most.
Health officials in many states say they don't have enough vaccine.
It's happening across the country. Promised doses not delivered.
On the call, CDC's Dr. Cohn thanked Massie for flagging their mistaken claim that vaccines were proven to work for people who've had coronavirus.
I think we read that book so many times that, we just skipped right over it. We know we can't be perfect. We know we're going to miss things.
You will forever have to be known in our office as Eagle Eye Massie.
Okay.
Thank you.
And they said, thank you for finding the mistake. We're going to fix this. And I thought, well, okay, problem solved. This is how government works.
But it didn't quite turn out that way. 2 days later, the same Dr. Cohn who'd promised a fix joined other CDC doctors in repeating the false information, this time in an online session for medical professionals. They wrongly claimed studies show people who've had coronavirus do benefit from the vaccine.
So, Sara Oliver, what should people who have had COVID-19 be vaccinated, and should they be vaccinated now?
Data from both clinical trials suggest that people with prior infection are still likely to benefit from vaccination.
Then, this past week, a full month after CDC promised to correct the false information, Massie found it was still on CDC's website.
So I called them up on Tuesday as soon as I could to ask them why it hadn't been fixed. And it was like I was starting all over with the same people. And instead of fixing it, they proposed repeating it and just phrasing their mistake differently.
I'm always happy to talk with you.
This call with CDC's Washington, D.C. Director Anstis Brand.
If there's a they who is refusing to fix something that is factually and provably wrong, I want to know who they is. Because this is going to result, and it's already resulting, in misallocation of the vaccine.
Well, let me check that and get back to you as soon as possible.
Massie also argued the point in a call with Dr. Sara Oliver, the CDC scientist who gave the misinformation on the web video.
Hi, this is Congressman Thomas Massie. Is this Dr. Oliver?
Yes.
There was an error, and I noticed you're an author on it, and I wondered if I could get your help in getting this error corrected. You can't say it's efficacious for people with prior infection. That's an absolutely untrue sentence.
Yeah, I mean, we're still recommending that individuals who've had prior infection receive the vaccine. But we wouldn't want to put out that if you've had COVID before, you shouldn't get the vaccine.
Actually, if you've had COVID before, and there's a 75-year-old person who can't get the vaccine, and you're 30 years old, you should not get the vaccine because you are wasting resource. It will lead to people who die or have medical complications because we have a limitation of the vaccine. That's why I think it's important that that document get fixed.
Okay, I can talk with MMWR and with Dr. Cohn and see if we can tweak that language a little bit.
Full Measure found several other scientists equally critical of CDC's incorrect claim. Jay Bhattacharya is a professor of medicine at Stanford University. CDC has had a scientific policy guidance on its website that claims the coronavirus vaccine has proven equally safe and effective in all age groups, races, and so on, and including for those who previously had a coronavirus infection, COVID-19. Is that your understanding? Is that true?
That second part is not true. People who have had previous infection, the vaccine, the evidence, the trial evidence shows that it is not effective in preventing additionally preventing the disease. Why would it be? You're already immune. If the CDC has it on its site, then it is doing the public a disservice. Both the people that get vaccinated that don't really need it because they've been previously infected, and also the people who should be prioritized with vaccine but aren't getting it because of shortages.
We asked CDC, Dr. Oliver, and Dr. Cohn for interviews, but they declined. Some of the agency's response was summed up during Congressman Massey's final call with CDC this past week. It was with CDC Principal Deputy Director Ann Schuchat.
I feel like right now we have the tail wagging the dog, that the folks who want to do the messaging, the folks who want everybody to get the vaccine, have pressured the folks who are doing the science, i.e. reviewing the phase 3 trial from Pfizer, not to correct the document. But the document is false. So the CDC can do whatever messaging they want. That's the CDC's job, not my job. But they cannot propagate false and incorrect science. So that's my position. And I'm really disappointed it's gone on a month without being fixed. Like, really disappointed.
As you note correctly, there is not sufficient analysis to show that in the subset of only the people with prior infection, there's efficacy. So you're correct that that sentence is wrong and that we need to make a correction of it. I apologize for the delay, but in terms of a large scale, trying to mislead people, I just give you my word that that was not the intent. So really apologize about the confusion that we apparently caused. And perhaps as you say, people who are fairly low risk rushing to get vaccine ahead of people who are higher risk.
CDC has now issued a correction, but Massey and other scientists we asked say the new wording still wrongly implies studies show vaccines work in people who've had coronavirus.
And instead of fixing it, they proposed repeating it and just phrasing their mistake differently. So at that point, right now, I consider it a lie. I think the CDC is lying about the efficacy of the vaccine based on the Pfizer trials for those who've already had the coronavirus.
As for how 15 scientists could have originally signed onto a paper that so plainly misrepresented vaccine studies, there's no clear answer.